And you're live.
Hey guys, it's Dr. Emer. I'm going to come over here so
go.
you can see me without seeing her. Hey guys, it's Dr. Emer. We did a surgery yesterday and we didn't post the surgery, but I posted someone very similar to her. And everyone today, I have like 12 or 13 DMs this morning, like, ask her to show us how she looks today. And the thing is, when somebody sees their body the day after surgery and they realize that a lot of times they then let me show you. So it's great. We had a really big transformation. She's a younger girl, very fit, but just had some irregular shaping in her hips and wanted a flatter stomach. So this is what we call a traditional Lipo 360 BBL, where we go all the way around the body. We even tighten the arm skin and we remove the fat of the arms, the back, the stomach, the sides, and we reshape the buttock. It's a lot harder than people think. And there's so many patients nowadays that are getting these treatments done for very inexpensive and not getting meticulous work done. And then the buttock sags or they have indentations and irregularities. So this is why I want to show you now my patient today, day one, how amazing she looks. It's unbelievable how flat, the nice hip to waist ratio, and also our lymphatic massage therapist is now removing oil, blood, extra fat cells, tumescent fluid, because that all causes the scar tissue and infection rate and all this type of stuff. When you do this aftercare, you don't typically get that. So come take a look. We're gonna hide our patient's identity, but I'm gonna be able to show you guys how she looks. And you guys can see, I mean, even in this first day, will you show them really quickly, just wipe a little bit of the fluid off so they can see how flat. You can see how flat her stomach is. Squeeze as tight as you can. I want them to see. Look at how even and flat and tight. This is because we did not only the lipo fat removal, but we also did a lot of internal heating. She previously had lipo and cool sculpting, and this area was it scarred down. It was very irregular. Now it's even and it's flat, and you can see the skin's still loose, and that's because there's fluid in there. So a very, very important part. And look over here. Already her ribs are starting to show. So you know she's going to be super skinny. The other cool thing, can we show on top? It's okay. I want you guys to see, look at this curve. This is the Emer hourglass is what I call it. Some people call it an S curve. This is where the waist is super snatched, and then there's the hips that come down into the buttock. I like a more elegant sort of contour, a more athletic shape. A lot of people are kind of doing the very overly voluptuous, huge hips. You can't get into pants, or then sometimes you have 2 tickets for an airplane seat. I think it's a little too much in my opinion, but I just want you guys to see day one. She barely any bruising because of the internal heating. She's actually feeling really good, which makes me super happy. And we're following all this aftercare, and you could see this amazing result. I mean, look at that. Squeeze in again as hard as you can. I'm actually going to take a picture of this so I can show her, because it's amazing what she looks like. That's kind of cool to see. And that's really it, you guys. And you can see the line in the middle is going to be really defined. She's going to be super slim on the side. And I did a little more elegant contour. I actually removed all the fat in the center and gave her a small line. A lot of doctors are actually keeping the fat here and creating more of an indent, so it looks more defined at the beginning. But then if you gain weight going forward, you have like a blob in the middle part of the stomach, which I don't like. So this is high def 360 female with internal heating, and it's going to be great. I'm sure that you guys can keep following. We'll go back in a week and see how she's doing, but it's doing phenomenal. We'll update you as the week comes. I'm going to show you.